Secura to present.
Good morning all. That was a wonderful session from Dr. Deepak Agarwal. The vision is, if AIMS kind of hospital can streamline the queue management system, I'm wondering why not the small clinics follow the same and small nursing homes follow the same. IT needs to penetrate so that it benefit to patient and it benefit to doctor as well. So how to convert a OPD into a smart OPD? One example of queue management is one module where patient waiting time is reduced. I'll show the case of AIMS and from where we have gone to where. And next is the right point of pre-consultation specialty at point of care. Why don't we introduce something called pre-consultation where it may not be in AIMS? There are so many general practitioners across, they don't have access to specialty consultants. If we could provide in some way this consultation at least 2 hours per week, they can do this whatever the questions need to be asked, symptom check, so that from a GP or from a pre-paramedic, we get the details and accordingly filter the patient to be referred to AIMS, so that the patient who needs attention immediately gets attention, not lost through the waiting time. Because we have limited doctors, we all know this. So how to streamline this overall process so that the patient who needs care is given priority rather than we getting the crowd and not providing who needs it. So my take on the whole thing is that we need to provide a degree of analysis to every patient, what is the disease stage, where he needs what intervention, accordingly streamline the entire healthcare process so that the GP gets what they want, the next specialty consultation what they want, and the super specialty consultation gets what he wants. So super specialty consultation, they don't have to spend time for a simple fever and then write prescription. Can we streamline this on the nationwide as a program? This is my request to all leaders here, because if we don't do this, this is going to get into mess. This is the time where IT is penetrating. Let's get into this and streamline the whole process. So the queue management is the one. So my topic is smart OPD. How to make a OPD smart so that the patient benefited, doctor benefited. Number one is automated queue management system, which Dr. Deepak already have given a complete view of what need to be done, how he struggled and how at last AIMS won to get it implemented. It wasn't easy, because I was also working with them for the past 2 years. I know what are all the things and how many meetings, and at last Dr. Deepak and team able to make it. Next is the automated review follow-up. Can we see, one is the pre-consultation module to be a mandatory system in every point of care. It could be a primary health center, or it could be a GP center, or it could be a nursing home. This should be made mandatory. And next thing is review follow-ups. Patient coming all the way from other places for review, can it be filtered again in the point of care itself, so that the treatment process is streamlined? So the patient comes, visits AIMS, goes back, and then the review happens there. Any input from doctor can be again done through IT. That's my one more idea to get this completely done. And fourth is then automated order management and fulfillment. Why don't we introduce something as soon as the doctor writes? See, if we connect all the GPs, specialty and super specialty in one network and completely streamline the smart OPD process,